Hello, namaskar, good morning. It's 27th of March 2022. It's around 5 a.m. now. I woke up a little bit early sometimes to read, to think. Um, so my I want to talk today a little bit about pharmacy as job related issue, if we can say. Man has multifarious faceted personality. In his personality, there is a part of him that is a father. There's a part that is a human. There's a part that is a mystic. There's a part that is a student. There's a part that is human. There's a part that is animal. And all of these parts come out day to day in our daily living, one way or another. And if you're a pharmacist, if you're a graduate from the University of Guyana Pharmacy Department, and like me, I graduated around 94. I went in there 88. After my hectic high school years, and I went in there and I did my best to come out with a diploma. During my time there was the old folks, the old founding fathers, the old students. In fact, the head dean then, Mr. William Jeffrey himself, was a student. He was a pharmacy student who was under the supervision of a dispenser. For example, my mom, who was a dispenser, he worked with her. He learned manufacturing and the basic tenets. During those days, the British era, they were training dispensers or people who were multitasking the prescribing, manufacturing, dispensing, and operating a pharmacy, what they then call in the British Guyana. In British time, they had the chemists and druggists and the dispensers. With this new American era, they are creating pharmacists. Diploma, BSc, Master's, PhD in pharmacy. Now, the problem is we have a situation of supervisory issue where pharmacists have to work in a health setting, whether it's a hospital, whether it's in the community, whether it's in a health center, a private pharmacy, industrial pharmacy, where they manufacture clinical pharmacy in the wards. But all of the drugs that people are using that they buy, the insulin, the ointments, the syrups, the lozenges, they're all manufactured by pharmacists. Now, long ago, the doctor, I think they were operating the pharmacists too. Long ago, they were everything, doing everything. But then as the medical field got more complicated, the job had to be broken up into nurses, doctors, pharmacists, dispensers, radiographers, microbiologists, and so on. So, yet the doctor, they say the export or the exporting medicine is a doctor. And ever so often the clash between the doctor and the pharmacist is there, where the doctor tries to operate the pharmacy and control the pharmacist. So eventually they have to have a body forming, pharmacy bodies, where the pharmacist can be protected, his job description can be minutely tabulated and defined in a proper way. But this helps him to function in his career at his place of employment and also to operate in his individual life as a medical personnel. People are saying that when your job finished. One day was that was during the early 2000. That time the building didn't burn down yet at Paradise there, the regional health office. And it was there golfing with a dark skinned guy who was working in the personal department at that time. He said, if you have why you have problem in your locality, your neighborhood, your community, when the day finish, you're not a pharmacist anymore, you're like everybody else. You have to come home and be like everybody else. But that's a very what we should say, loose way of putting things, because not everybody are equal. You must realize that people are trained differently. Our instinct, our psychology, our feelings, our sensitivity are tutored, trained, developed day to day by our teachers, by our environment, by our parents, and so on. If you came from educated home, then your